Module 4, Healthcare Reform in 2 States. What is healthcare reform? The purpose of healthcare reform is to increase the number of insured individuals while increasing the quality of care and trying to stabilize costs all at the same time. Healthcare reform is needed because most Americans have little to no health insurance to cover their medical costs. Healthcare reform means better care for everyone. It allows help for individuals to get health insurance who couldn't before. Specific policy changes of healthcare reform in the state of Florida. Lower projected premiums, lower medical claims, a lower percentage of cost increases in 2018, extending access to health savings accounts, extending short-term health plans, and allowing insurers to charge older people 5 times more than younger people. Specific policy changes for healthcare reform in the state of Georgia include providing affordable healthcare insurance to more Americans, change the healthcare delivery system, provide more resources regarding healthcare plans, expanding access to healthcare coverage, and increased availability for zero premium health plans. Florida and Georgia's similarities regarding healthcare reform include both main states' goal is to provide the best comprehensive and affordable care and coverage to all individuals regardless of its diverse communities. Both states have quite a diverse community and they both take pride in making healthcare affordable to everyone. Each of the 2 states are creating new innovative ways to cut healthcare costs for Americans. The state of Florida and Georgia offer the Affordable Care Act to lower-income families. Florida and Georgia's differences regarding healthcare reform include each state has its own set of rules and regulations regarding healthcare reform. Each state refers to as poverty level to qualify for the Medicaid program. In the state of Florida, the income eligibility for a family of 4 is $8,197. In the state of Georgia, the income eligibility for a family of 4 is $5,000. Between both of the states' healthcare reform programs is the number of individuals receiving government program assistance. In the state of Florida, the numbers are steadily increasing. In 2018, the ACA provides health and long-term care coverage to nearly 4.4 million low-income children, pregnant women, adults, seniors, and people with disabilities in Florida. In the state of Georgia, in 2018, the ACA provides health and long-term care coverage to more than 1.7 million low-income children, pregnant women, adults, seniors, and people with disabilities. Final recommendation. I believe the Rasmussen healthcare systems should expand from the state of Florida to the state of Georgia and become one because these 2 states have so many of the same great qualities, and to become one, this would be huge. These 2 states have many good qualities, such as the care and compassion they have for the individuals that reside in their states. Both Florida and Georgia take pride in their healthcare reform and make healthcare coverage affordable to all individuals. Both of the states have expanded their Medicaid programs to cover all adults with low income, below the poverty level, and support innovative medical care delivery methods designed to lower the cost of healthcare.